Okay, I am showing my surroundings. Here's my Joe. I have my provider's orders. And then my setup. And then I have a garbage can down there that you can't see, but it's there. Okay, setting up so you can see. Let me go back some. Yeah, there we go. Okay. So, hi Joe. My name is Danielle. I'm going to be your student nurse today. Continue dressing. I have provided privacy and I'm going to perform hand hygiene. Can I get your first and last name, Joe Smith, and your date of birth, 10/5 of 30 or 53. Do you have any allergies, Joe? Sulfite and betadine. Alrighty, so today I'm going to be changing your surgical dressing. Is that okay? Alright. Subject is alert and orientated ×4, which is important for signs of infection. I have provided hand hygiene. So the 9 principles of sterile technique are, I have a 1-inch border around my cloth that is not sterile. Fluid flows in the direction of gravity. Always be honest. If you break sterile field, you need to restart. Skin is not sterile. Anything below the waist is not sterile. Never turn your back on your sterile field because you don't know if something is going to fall or make it unsterile. Sterile equipment can only touch sterile. Sterile equipment can only touch sterile objects and such, otherwise it is not sterile. So I had my 1-inch border, my honesty, gravity, skin, fluid, sterile. Skin is not sterile. So my 1-inch border, I have the 1-inch border, gravity, honesty, sterile, fluid, anything below the waist, never turn your back, skin is not sterile, honesty. What am I missing? So I have my 1-inch border that is not sterile. Skin is not sterile. Anything below the waist is not sterile. Sterile equipment can only touch sterile objects. Fluid in the sterile bowl is only sterile. Once it leaves the sterile bowl, it is not sterile. I think that's what I was missing. And then honesty, if you break sterile technique, you need to restart. Never turn your back. Anything below the waist is not sterile and skin's not sterile. Okay, so I have my setup here. First, I'm going to check the integrity of my equipment. So my tape is okay. My saline is not opened and it's not expired. The expiration date is 8/22 of 24. The fluid is clear, which is what it needs to be. My my sterile pad is, the integrity of the packaging is good. It is not expired. My my sterile sponge is not expired. My other sterile sponge gauze is not expired. My split sponges is not expired, and the integrity is good. My my sterile gloves are not expired. They expire in 11/24 of 2024. And my sterile objects are not the integrity of the packaging is good. I'm making sure that I'm actually gonna put this down. My bedside table is at waist height, and so is the bed. I don't want it any higher. I'm checking with providers' orders. Today I have Joe Smith. I'm going to be changing his surgical dressing, making sure that I cleanse the surgical wound with sterile water, apply 2 split gauzes, 1 gauze and 1 ABD, and to secure the surrounding wound with tape and document the wound and everything else. So first, what I'm going to do is I'm going to get my towel. I'm going to hold it like a hamburger, and I'm going to open away from me and making sure I don't have it on my sterile field. So I'm going to I'm unwrapping it like a cheeseburger. And I'm finding this corner here. Because I have my 1-inch border, I'm gonna grab my corner like this, and I'm going to throw away keeping it above the waist. I just wanted to make sure I threw it on the floor. I'm gonna grab my other corner, and it is going to unwrap. Here, let's do it this way. Okay, I'm going to grab this way, and I am going to put it down away. Yes, I'm going to put it down away. Anything that hangs over the table is not sterile. I'm going to raise this a little bit so it doesn't touch the bed, and I have my 1-inch border. Now I'm going to open my bowl, not above the sterile field. I'm going to make sure that I open away, keeping a hold of the lip of this bowl. I'm going to place it within the 1-inch border of the sterile field. Okay. Now, my tweezers, I'm going to roll it, making sure I do not hold it above, and I'm just going to drop it in the bowl like that. Take that off. Now, I'm going to open my thing. I'm going to open it without ripping it, and just do that, making sure it's in the 1-inch border and throwing it away. Same thing here, bending away and not above, and dumping it on top within my 1-inch border. I would not rip my package, but I accidentally did. In this case, I would grab a new one, but I don't have another one, so I'm going to be using it. Making sure it's in my sterile field. And my saline, I'm going to make sure it's in the palm of my hand. I would verify with another nurse that that this is what I need to be using. I'm going to open the cap, throw that away. I'm going to pour some in the garbage. Anything below my waist is not sterile, but I have to kind of lean a little bit. Okay, I poured some out. Now I'm going to pour only a few inches above the bowl some of my sterile water. I'm going to put my cap on, and I'm going to set it to the side. Now I am going to I'll put it on the bed. I'm going to open my gloves, and I'm going to put them on. So first I'm going to open these. Opening. I'm going to pull this top part. Making sure I don't get on my sterile field, and I open them, I'm going to start with my dominant hand holding the inside of the cuff. I'm going to put my glove on like so. And I would not be wearing my watch. I forgot to take it off, but since I already have my gloves on, I'm just gonna leave it, and then I'm gonna throw this away. So I have my gloves on, and now my hands are sterile. I can touch my sterile field. Okay, so I did do something wrong. I should have taken the dressing off the wound before I put my sterile gloves on, but I didn't do that. In this case, I would get a new pair of sterile gloves, and but for the sake of this video, I'm going to keep them on. I should have taken the dressing off before I set off my sterile gloves with normal gloves, but for the sake of this video, I'm not going to take off my gloves. So looking at the dressings, I have quite a bit of fluid, quite a bit of drainage. I have serosanguinous drainage, and my dressing, or my surgical wound, is granulated. I'm going to make sure that I keep my hands above my waist and make sure I don't turn my back on my sterile field. So I'm going to place 2 of these into the water. I'm going to sacrifice my non-dominant hand to hold the drainage tube. So I'm going to pick up the tube and I'm going to cleanse around and drop it in the garbage. I'm going to grab my second gauze and rinse around and dropping that in the garbage, and this is not sterile, so I'm going to drop it over there. Now I'm going to grab my first one. I'm going to use the Pac-Man and just drop it, making sure I don't touch the skin because the skin is not sterile. I'm going to grab my second one, get my Pac-Man ready to go, and I'm going to do it the same way but opposite. Dropping it, making sure I do not touch the skin because skin is not sterile. I'm going to let go of my doohickey and place my one gauze, not 2 gauzes because the provider's order does not say that. 1 4x4 gauze, and then my ABD gauze over top. Oh, okay, I would not touch my non-sterile hand with my sterile thing. That was my mistake. But for the sake of this video, I'm going to keep going. And I would label this with my name, with my initials and today's date. I'm going to get some tape and just doing it one on each side to secure. Go. I would document the amount of drainage and the type of drainage that I seen. There was no signs or symptoms of infection. The wound did not smell, and the tissue around the wound is nice and pink. It is not dark, and his level of consciousness is 4 times 4. So I'm not concerned for any signs of infection. I'm going to make sure I document my findings and properly dispose of my non-sterile items. I'm going to take off my gloves by pinching the one side and slowly grasping in the other, putting my fingers underneath and throwing it in the garbage. Joe, is there anything else I can do for you? Are you comfortable? Okay, I'm going to make sure the bed is lowered. And it is. It's lowered, locked, no signs of risk. I'm going to no signs of fall risk. I'm going to document my findings and clean up my surrounding area. Thank you.